COVID-19 pandemic has left people all around the world anxious and unsettled. Without ways of supporting each other and finding ways to look after our mental health, the psychological consequences will be significant. China has recorded a significant increase in divorce owing to the lockdown. Likewise, in the United Kingdom, there is a lot of attention on mental health as well as domestic violence. In Kenya, experts recommend that priority is given to protecting our mental health. Now more than ever, mental health advocates and counselors need to provide both physical, online, and phone assistance.
I seek that you remain calm. I do not wish to scare you. This is a very serious threat to our lives and to our nation.
Catherine Wekari, a trader from Kiambu, fears for her business at this time of the global pandemic.
Tunaleta boga lakini wateja hakuna. Ni hao watoto wako nyumbani, biashara iko chini, hakuna pesa, hakuna wateja.
Leila Faraj is still trading in an open-air market in Kapsabet. Customers have become fearful of the COVID-19 virus and are very cautious.
Kila mtu anaogopa hata kununua kama una vitu vya kuosha mkono, sanitizer ama nini, customer huwa akukaribi. Na watu wengi sisi pia tunaogopa manake hatujui customer yupi anatoka wapi.
With the prevailing dusk to dawn curfew, school and work schedules indefinitely disrupted, businesses closing down, massive job losses, health workers stretched and risking their lives, rising numbers of COVID-19 infections, one thing can easily be ignored: mental health. The past 3 weeks have been anxious and unsettling, and the psychological consequences are beginning to show. We asked Alice Nzangi, a clinical psychologist, just how COVID-19 is affecting our mental health.
Anxiety is rating high, and of course those who are already having mental issues, there is a possibility this could increase.
Persons with pre-existing mental conditions such as depression, schizophrenia, hallucinations and OCD, obsessive-compulsive disorder, may relapse and may not find adequate care, including medication. So, how can you tell that one's or your mental health is being affected during this time? Nzangi notes that a drastic change of a person's regular behavior is a warning sign. Look out for lack of sleep, feeling sad all the time or getting angry easily, the inability to relax, hearing voices of people who are not present, panic attacks, loss of appetite, increased heartbeat, withdrawal, increased use of alcohol and other drugs, lack of energy and thinking about death most of the time. Experts recommend that as soon as these signs show, it is important to seek professional health care.
Most people's minds, they have been shut and the direction is only COVID. So I cough and it's like, I may have gotten that because in my mind now I am sick. So you find even when I didn't have the infection, I am actually feeling I cannot breathe. I'm having difficulties in breathing. I'm even feeling hot and all that. And you find there are so many people who will have psychosomatic symptoms of COVID-19.
Globally, especially where lockdowns have been imposed, the social fabric is falling apart. Divorce lawyers are filing record-breaking caseloads. This is not because of infidelity, the main reason previously. Instead, it is the lockdown which is bringing out latent tendencies for violence that were there before but hidden. This is notable in Shanghai, Xi'an, and in China's central Hubei province. Incidents of domestic violence have also multiplied globally. The trend is a warning being given in the United States and Europe, where people are in the early stages of isolation. UK's lockdown campaigners have warned that the COVID-19 outbreak will lead to a domestic abuse pandemic. There has been a 20% rise of domestic abuse in Northern Ireland, 32% in Paris, and 40% in New South Wales. Police are also very busy enforcing quarantines and are unable to respond to emergency calls from battery victims. Both women and men experiencing violence are unable to leave their homes. Courts issuing orders of protection are either closed or slowing down operations. Canada is increasing funding for the most vulnerable during the outbreak.
For far too many people, home isn't a safe place to be. For others, it's somewhere they're isolated and alone. And you're watching the world you know change radically. It's a source of anxiety. It's a source of tension. Maybe there's extra tension in your family. But there are people who can help.
In Kenya, the cracks at the time of social distancing are beginning to show. Man is innately social, and limited physical touch means people have to find different ways to reassure each other. Trivial matters in life can lead to the escalation of conflicts. 24 hours, shared surroundings, health worries, fears about income, and poor communication could cause spouses to be disappointed in marriage and make the decision to divorce.
Let's try to prevent the mental disorders, the fears, the stress, the depression, so that we don't get there.
WHO recommends avoiding news that causes one to feel anxious or distressed. One should seek updates at least once or twice a day. Likewise, one should follow guidelines given to protect themselves and loved ones. It is important to stay connected to other people, to have rest, enough sleep, at least 7 to 8 hours a day, and a balanced diet, to wash hands and sanitize surfaces, but not excessively. Millicent Kagonga, a cancer survivor, exercises at this time at home to maintain a healthy physical and mental state. Even if and when the epidemic abates and life returns to relative normalcy, the psychological and economic strains are expected to endure months after. Already, stigma and discrimination against caregivers and persons suffering from, being treated for, and recovered from Covid-19 is being experienced. More than ever, to prevent a psychosocial pandemic, caregivers and mental health advocates are needed to provide both physical, online, and phone assistance. Dorcas Wangira, Citizen TV, Nairobi.